do preventative therapies for migraine modify migraine disease? Do they make the disease biology more quiet, or do they just suppress symptoms? And that answer remains pretty much an open question. If we thought that they modified disease, then what we would see is that when we would wean off a preventative therapy, a remission would be induced in a sustained way, because they've induced some changes in the brain or networks in the brain or structures in the brain that migraine was responsible for, and it undoes some of that biology that we do not like. But the studies haven't really proven that for sure. I mean, the studies have really shown that most migraine preventative therapies, when they're stopped, people may get a little bit worse, but typically don't get as bad as they did before they started the preventative therapy. Now, that could just be because we don't follow people in these studies long enough to see them kind of regress to where they were before. But it's also really a completely mixed bag. Some people have a great prognosis coming off of preventative therapy. Some people may revert back very quickly, even if they're doing well. And there's a big area of research needed to understand who is at a higher risk for relapse of migraine off of preventative therapy. It's just they have really tough chronic migraine. And if we stop it, we know things are going to relapse in a tough way. And that's realistic. Thankfully, we have better treatments that are safe. And in the long run, they can be maintained without too many issues. But I think in general, it starts with the beginning. There should be optimism from when a preventative therapy is started, whether it's a primary care clinician, whether it's a neurologist or a headache specialist, or whoever the clinician is, that this will not be forever. This is going to be for a period of time to get things under good control. And then we're going to consider, stopping it or reducing it when the time is right.